Hi everyone. Happy Friday. Can you just wave if you hear my voice? Good to see you all. So we're going live today with lovely Dr. Anna Kabaka. I'm going to invite her in a minute. Hi. And if you have any questions, do not hesitate to either write it in the comment or in the question bubble, so we try to get back to you with the answers. So let me see. Hi. Hi, Jody. Hi, Mariam. Good to see you all. I'm just trying to invite Dr. Anna. Oops. Hi. Let's see if I can find Dr. Anna. So if you have any questions about perimenopause, menopause, transition, all the changes, definitely right here. Dr. Anna is the best person to ask all these questions. All right. So we have a message that unable to join. So that's good. Hi.
Hey there, how are you?
I'm good. How are you?
I'm great, thank you. Thanks for
Good
having me
to see
on.
you. Yeah, I'm so happy to have you here again.
There we go.
Oops. Let's see. This is connected. So invite again. Hi.
There we go. There we go. Turn some
So
lights on here. How are you doing?
I'm
Thanks for
very
having me.
well. I'm great, especially seeing you here.
Well, likewise, I feel the same. So good to have you, good to be here with you.
Yeah, it's just amazing. So I was just talking to one of my friends today, and she was saying it's how amazing what you and I and other health providers doing on these platforms day and night to educate women, empower them, and help them to find their voices, advocate for themselves about what their body needs and how their body changes, especially that we spend at least half or one third of our lives in menopause. So what more important than spend it gracefully and with power and knowledge.
Yeah, absolutely. And the more we have, the more knowledge we have, the more empowered we are,
Mm-hmm.
the better we can advocate for ourselves. Right. And I think that's so important with what you're doing. I see like, yes, yes, yes.
Yes, yes, yes. It's so important. I personally think that since I go through perimenopause and noted all these changes in my body, I can relate more to my patients. I'm a better doctor, so all these changes very important to notice those changes. Sometimes we not or we forget with all the stress day-to-day life. I'm mother to twins almost in 2 months, 13 teens, so so much stress. And I'm sure a lot of women out there go through the same stressful times with work, with household, with kids during perimenopause. So it's very important. It's not all about sex hormones, I think. It's about the whole other changes going around us. I don't know, what are your thoughts on this and how holistic approach is so
Well,
important? I hear you all the time.
yeah, absolutely. It takes more than hormones to fix our hormones.
Mm-hmm.
And now with a lot of the hype, we think, oh, well, the answer is in hormones. And that's part of the answer. That may be part of the answer. But what's
Mm-hmm.
going on? What's causing the chaos? We're designed to, you know, produce hormones for our entire life. So what's interrupting them? I think that's a really big piece. And like you said, you know, again, the more we are able to know about what's happening in our body, the best next right step we can take. And it's usually, I tell my clients, one next right step at a time. And that is key. That
Yeah,
is key to managing.
it is. It is very important. I mean, again, I was around the time that training medical school, hardly ever were trained about menopause, hormones, and none about perimenopause. So this is a whole new era, I think. That's why it takes time to go through all these changes and talk about it. I think the more we talk, the better outcome, and hopefully, again, I see women go and see OBGYN or conventional doctors, and um, if they're lucky to get hormones. But I think the approach is, so they have the hormones and there we go, off you go, and that's it. I think there's so many other things that we can optimize our hormones with, not only hormones. So it's important as a, I think we're in a better place with functional approach and holistic approach to how to deal and optimize these hormones. So you talk a lot about these changes and how to optimize, first of all, naturally. We love to hear you here again one more time.
Yeah, yeah, happy to share as much as I can. And I think that, you know, first thing, I wouldn't know what I know if I hadn't had my own personal journey as well. Right?
Mm-hmm.
If I didn't find myself at age 39 diagnosed with infertility, failing round after round of fertility treatments, and then being diagnosed with early menopause. And then through, honestly, God's grace and my healing journey around the world, I learned different traditional medicine, ancient medicine, Eastern to, theoretical integrative approaches that help me in reverse the early menopause and naturally conceive the child I was told I would never be able to at age 41.
Yeah.
So if you're listening and you're like, okay, I don't know what's going on with my body, or I'm having these diagnoses, or, I'm feeling like a wreck, I'm not at home in my body anymore,
Mm-hmm.
then listen, there's hope. There's always hope. There's always one next right step at a time that you can take. And so for me, it really started with integrating the Eastern and Western approaches that I'd learned over the years. Now being age 58 with a 16-year-old, you guys, is even more important to balance our hormones and keep our head on straight, right? Keep our memory intact, and our boundaries intact as well. And so a few key things that I always recommend is it incorporates into my nutrition and lifestyle approach. And my first book that I wrote, is called The Hormone Fix. And this is really where I emphasize that it takes more than hormones to fix our hormones. And I introduce the keto green approach because as we're aging, I mean, mid 30s, our progesterone and DHEA levels are the first to start declining.
Mm-hmm.
And so as this is changing, our brain's ability to use glucose for fuel also changes. So I start working with intermittent fasting, addressing the significant decline of progesterone with reducing cortisol and resetting our circadian cycle, so to speak, checking urine pH, doing some the intermittent fasting with a very alkalinizing approach. I call it my keto green nutrition and lifestyle plan. And to incorporate these things, and within weeks, within a couple weeks, I see a lot of these hormonal symptoms go away, and people are like, God, I feel better than I have in years. Or sometimes people are like, I didn't realize how bad I was feeling till I started feeling good again.
I know. I had one of those. I came to your 2 weeks detox, green detox, and keto. It was amazing. I felt so good. Yeah, with all the maca and the alkalizing and checking the pH, so it's just
Yes.
great. So if you just a little bit talk more detailed about this 2 weeks keto
The
diet
keto Green 16 challenge is what you went through. And
for
so
6 weeks.
with that and mentioning the urine pH, listen, urine pH is as important a biomarker as your heart rate variability, as your blood pressure, as your pulse, as your blood sugar. I mean, our urine pH tells us so much,
Mhm,
and, and it is so key to understanding how your nutritional environment and stress, perceived or real,
mhm,
affects our physiology and can put us into a state where we're breaking down, where our bucket, so to speak, is empty, right? Like we feel like I've got nothing left to give, our reserves are gone. And so incorporating that alkalinizing approach as we periodically bump into ketosis is game changing. And so, a few things to help us do that is the intermittent fasting, but a reasonable level, like 13 to 16 hours. I think that's really key. And when we look at our metabolic clock genes, especially as women are concerned, we want to break fast by 10 or 11 a.m. ideally. Okay. Everyone's individual, and I want you guys to play with that, but we really want to break fast by 10 or 11, or we can start, forming more uric acid, get into a catabolic state. And this is the difference, right? We know, listening, men and women are different, right? Men and women are different, but men have 10 times as much testosterone. That
mhm,
keeps them able to do longer extended fasting too without getting catabolic, so to speak. So
mhm,
that's a really key piece. Plus the alkalinizing foods from traditional, like medicinal menu, we know that the ancient physicians way in the Ottoman Empire prepared the food for the kings. So in my programs, I incorporate medicinal menus that are designed to support phase 1 and 2 detoxification, to support estrogen detoxification, to support our gut bacteria and our gut microbiome. And without taking any drugs, we feel so much better. So
it's amazing. It's so important. I can't stress more how important it is. I mean, I've seen sometimes patients come to see me, uh, seeing their OBGYN, having hormones and not feeling better with those hot flashes and bumping up the dose and go up and up. Sometimes is not helpful and not the answer. There's so many other things. I think maybe there is an absorption issue, or maybe, as you mentioned, gut health and other detox pathways are not open. So very important to look into those too. So important.
yeah.
Uh, so a few questions here in between. If you don't mind, I go to some questions. Someone is asking about supplements. What supplements are helpful during, she's 45 and she wants to know for her age if you recommend any supplement to help and optimize with the hormones.
Okay, so number one supplement, hydration. Number two supplement, sleep. Number three supplement, playfulness, oxytocin, everything we can do to increase oxytocin, right?
Yeah,
But then to support detoxification, I've got my Mighty Maca Plus, which has 30 superfoods combined in an adaptogenic blend to support our adrenals, to support our physiology, our alkalinization, and detox. So this is one of my key supplements that
I
I
love
start.
it.
It's a foundational. I start all my women on that, and men too. And then my balance cream, which is progesterone and pregnenolone topically, especially if we're having irregular periods, PMS. We want to support from the inside out and the outside in. So gentle absorption of progesterone and pregnenolone. And then I put tripeptide in it because if we're putting something on our skin, we want those good,
Mhm.
healthy skin benefits too. And then, supplementing with DHEA. I use transdermal DHEA. Any oral forms I found caused me acne and a
Mhm.
history of, the phenotype, the genotype for PCOS. And so, or polycystic ovarian disease. So I'll convert more testosterone to dihydrotestosterone. And so I started using it also on the vulva and vaginal area to help with things. I've had 4 big babies. And so, bladder leakage, dryness issues, and just time the changes associated with time, like you have clitoral shrinkage, decrease in your vaginal, I mean, increase in your vaginal pH, so more susceptible to HPV and other infections. So we
Mhm.
want to maintain the health of that, I say, most important real estate of our body for our entire life.
So that is DHEA
It's
and
it,
combination of.
This one is DHEA with alpine, the stem cells, plant stem cells from the alpine rose plant, which is a rose that grows in the Swiss Alps in the harsh conditions of extreme weather and rocky terrain. And when I looked at the original research, as I was looking at what additional combination to put in for this formula, the stem cells are also, they're anti-aging, they have some antiviral approach, they improve collagen production, and also just this rose blossoming in this, harsh terrain is just an example of femininity, especially as we age, right? Showing up no matter what, showing up for our family, creating a legacy that we're proud of. So these beautiful alpine rose plant stem cells are just amazing. And I also put other emollients in to help drive the ingredients deeper in the tissue. It's better than anything I can write on a prescription pad for that, for
That's
sure.
amazing. Great. And where can people find that? Is
So
it
dranna.com. So dranna.com.
definitely? And is it once a day or twice a day? Because normally estrogen, vaginal estrogen is around twice a week we do, but with DHEA, how frequent women?
I really want the regenerative properties of it. So I typically start a client out every other day for the first 1 to 2 weeks, and then daily, for maintenance. Like we would brush our teeth, use any skin cream and just have a beautiful saffron skin cream on right now. And, we want to maintain it regularly. So continue to use it. And because, I always say, if it doesn't give you pleasure, why would you insert it in the vagina? But anyway, that's one thing. It's a pain. And I was thinking about that this morning. It's a pain to use the inserts into the vagina. And also, as sometimes they don't absorb as well. So being able to apply something exterior that, that is well absorbed interiorly is easier to use, increases compliance, and
Yeah.
increases the benefits. And plus, with DHEA, you don't worry about transference if you have a male partner, but with estrogen, you need to think about
Yeah. I hear a lot of patients complain about estrogen, how messy it is when you do the transvaginal uh, products. So that's then great substitute. Someone is asking about your the maca supplement, and is it safe for Hashimoto and endometriosis?
Yeah, I have I've used this now for 15 years from when I formulated it from my world journey around the world and experiencing different medicinal plant foods. And so I've used it in Hashimoto's patients, Crohn's patients. I create a very clean, safe formula because even my granddaughter, who's now 2.5,
Oh,
she's been drinking it since she's 1 year old. I mean, and she's just adorable. She's like my biggest Mighty Maca fan. She just loves it. She just loves it.
oh,
And I feel safe about giving it to her because I've, sourced all the ingredients. And we've been using the same Peruvian maca source for now over 14 years. So 15 years, yeah.
yeah, it's
So it's
amazing.
really good. And usually if you've got
Okay.
detoxification issues, or you have a history of Crohn's or celiac, and, start at half a scoop a day and
Mhm.
just give your body a chance. And then usually I'll have clients, especially with adrenal issues, go to 1 to 2 scoops a day, and even twice a day if needed. There's no product that I found in my now 30 years of practicing medicine that works better than this for the
Right.
adrenals.
Especially someone, the next question is about someone who had recently saliva test with high cortisol and asking about, I think she started ashwagandha and rhodiola, but any other suggestion? Again, I think this maca is amazing, isn't it?
Yeah, it really does work well for that. It
Yeah.
really, really does work well. And so like for those issues with the adrenal issues, of course we know that we want to get them on a good bioavailable and methylated B vitamin supplement.
Mhm.
We want to increase their vitamin C levels. And so those additional supplements too, and also again important to empower oxytocin. I write about this in my books,
You
online
talk
and
a lot
teach.
about oxytocin,
Yes.
and again, how important this hormone is in bonding, promoting that emotional connection, social connection. So, if you talk a little bit about, first of all, where does oxytocin come from in our body and how to optimize the levels if we think we're low on
Yeah.
oxytocin?
We used to, and to give people a background on oxytocin, again, not to be confused with oxycodone, which is a painkiller. Oxytocin we produce naturally when we orgasm, when we laugh, when we're playing, when we're doing things we enjoy and we love doing. And playing with a pet, walking out in nature, we
Mhm.
increase oxytocin and it opposes cortisol. So when we're stressed, oxytocin goes down and cortisol is up. When oxytocin's up, we're able to modulate cortisol a lot more. So these oxytocin increasing practices really make a big difference. We used to only think that it was secreted in the pituitary and the placenta, but we know that the heart has receptors for and will produce oxytocin, which makes sense because it is our organ of love. And oxytocin is a hormone of love, an emotion of love too, and joy and peace and trust. Those are key factors. But it's also, you know, um, age enhancing. So it helps regenerate muscles,
Mhm.
helps with the immune system. We've seen, use it in some of my long COVID protocols and has
Mhm.
many benefits, but through different tissues in our body, we can produce oxytocin, including the ovaries. At the time of ovulation, we get a little surge of testosterone, makes us a little bit more higher libido, and
Mhm.
also a little more oxytocin at that time too. So we can get
Right.
these spikes as part of our natural cycle.
Get ready to get pregnant naturally, if yes,
Mhm.
all these hormones. So we talked about oxytocin and sex hormones. What about other hormones? How to, I mean, we see during this time one of the main complaint of women is weight gain and sudden change in body composition. We see, I've seen it in myself too. So we see insulin and cortisol, thyroid. So normally, what's your approach? How you first of all check the levels? What are the tests if you do any, and the recommendation how to deal with all these changes?
Yeah, so I think it's important as our reproductive hormones go down, and these are our anabolic hormones too, right? They build muscle and bone. Our catabolic hormones like cortisol and insulin go up as we age. And so it's important to recognize, okay, well, I really need to focus on improving my circadian rhythm. I need to improve my insulin sensitivity as we age because despite, just from the natural part of aging, we're going to have this shift, and if you add stress into the picture, it further decreases our natural protective progesterone levels. So with, like understanding that, we've got to do things to become more insulin sensitive. So bumping into ketosis, periodically
Mhm.
restricting carbs, doing some more intermittent fasting or extended fasting helps with insulin sensitivity. And I test, I teach my clients too. I have an 8-week long program that we're launching right now, actually. And so I teach them how, what to test for.
Mhm.
And the right timing of the testing is really important too. And so that becomes a really important piece to look at to see, okay, well, what's going on? And the weight gain, hair loss, rapid aging, none of that really has to happen. I say at 39, I was over 240 pounds, pre-diabetic, completely infertile, really struggling. And I'm at 58 now. I mean, there's every day there's a fork in a road. How do we choose to make today? I don't know how that happened, the balloon. How do we choose to make today better for ourselves? How do we choose to make tomorrow better for ourselves and for others? And I think especially as women, we're taking care of everyone else, and we sometimes think if I can help them, then I'll be better. It really starts with, especially children, it starts with helping ourselves. So the self-care is so important to, for our families. Our own self-care makes a difference. The energy we show up with, the way we're able to have healthy boundaries, the way we're able to respond will all make a difference. So with like this midlife weight gain, and again, diabetes and heart disease on both of my sides of my family have the genetics to make weight gain a normal part of our characteristics. So really addressing these issues with the insulin sensitivity and that alkalinization component and the hormone balancing, focusing on the things that help us restore our body on a regular basis, so that in our 70s, 80s, and I like to say naughty 90s, I want to be a naughty 90. I do. And so, we have the our brain capacity, our physical capacity, our heart capacity to really enjoy all the things that we've created in our lives.
You mentioned about 8 weeks program. Can you explain a little bit more about that?
Yeah. And for those who are listening, we're doing a masterclass tonight too at dranna.com/hormone. So you can find that link or just go to dranna.com and there'll be a banner there to invite you to that. But my 8-week program is Magic Menopause. And I've been doing it. It's in its 10th year. And I think, that we're now certifying coaches as we go through the program too. We're getting more menopause coaches on board to really help people navigate the lifestyle and the changes that are happening to their body during this time before, during, and well after menopause. So in Magic Menopause, I teach understanding your lab results, what are important testing to get, as well as advanced testing. I teach about, again, just to address what's causing the weight gain, what's causing the hair loss. We have weekly menus to go through with medicinal menu plans. We are in a community group together and weekly live coaching calls with me. And so in the group setting, so it's really a beautiful supportive community, which we often need. I would say create the community that, that you want, that you want around you. And so that's what I've done.
In Canada, we need this.
Everywhere in the world, for sure.
I know. It's great. What about, we know we talk always about food. Food is medicine. It's so important. Seasonal, organic foods, of course, as much possible. I would love to hear a little bit about anti-inflammatory foods. What are the things that you normally suggest to take on a daily basis and help with some of these changes and transition time?
Yeah. So always, variety is key. So and we want to think about, we want, like you said, organic, free range, wild caught, no pesticides, herbicides, because all of those are hormone disruptors. So we want to focus on good, clean, healthy protein and make sure we're getting enough protein. So those, like, what did I have last, yesterday, for example, I had grass-fed beef, Primal Round. It had organ meat in it with the beef, with the ground beef. And so it's a Primal Round burger with a side of arugula salad, some sliced tomatoes, squirt of lemon juice, dash of olive oil, and a side of avocado, and some sauerkraut. So like there you have fermented food to feed the gut. You have good, healthy, high quality protein that you want to chew really, really well, because digestion starts in the mouth. And you have the alkalinizing fiber, rich greens and vegetables to help support digestion and hormonal balance and detoxification as well.
So it's a mix of everything, really, a balance.
Yeah.
Good.
But I would say some of my favorite foods are like smoked salmon. I love smoked salmon. I love za'atar. You know za'atar? So yes, the dried thyme with sesame and a little salt is in there, or sumac, which is another herb. But it's anyway dried thyme and sesame, and you mix it with olive oil, and you can put that on your fish. You can just eat it on a cucumber, or it's like, and it's such good brain food, right?
Yes. It's great.
It's one of my favorite herbs. Yeah.
So I see your videos you started doing some boxing, kickboxing. So tell us a little bit about exercise, physical activity, how to choose the right physical activity during perimenopause and menopause.
So do the exercise that you enjoy
Mm-hmm.
and change it up, and continue to challenge yourself and change it up. So there's that piece. I have been boxing since 2007, on and off. I had frozen shoulder last year, so I really had to work through frozen shoulder and figure out some of the things there. But so I've been boxing in and out, on and off for now since 2007. So quite a long time. And I love it, right? I love it because it's a meditation for me. Because when it, for anyone listening, ever do any boxing, but if you do mitt work where you have your partner has mitts and you have to focus on hitting the mitt, you can't think of your to-do list or you're going to get hit with a mitt, like you just can't. So I was never really good at sitting and meditating. And
Mm-hmm.
so this boxing became my meditation. And now I do a lot of walking because I walked the section of the Camino de Santiago this
Yes,
summer.
I
And
saw that.
oh my
Yes.
God, it was incredible. If you get an opportunity to do it, I highly, highly encourage it because for me, it was one of the most transformational things I've done in my lifetime.
How many days was that?
I walked for 7 days, 150 kilometers. So there are people that walk 5 weeks or, any duration to get your Compostela de Santiago. You need to walk at least 100 kilometers and you get stamps along the way of places you visit to show that you walked it. And then you get this beautiful Compostela de Santiago too when you reach Santiago de Compostela. So it's just beautiful. It's just a beautiful journey.
You walked all the way.
100 miles. That comes to 100 miles of walking in 7 days. Yeah. So,
And
yeah.
thereafter, you went to India. I saw pictures of you India with your family. Beautiful.
Oh my gosh, it was incredible. This summer was just an incredible summer, and all, the Camino de Santiago I walked by myself, but then I brought all my family, all my girls with me to India. My brother's been living there for 5 years, so I also dove in deeper while I was there to the Ayurvedic medicine, some of the traditional philosophies and ancient wisdom of the culture, which is profound, profound.
It is so much to learn every day.
Yes, constantly, constantly.
What about hormones now? If we want to talk a little bit about hormones, estrogen, progesterone, and what are your thoughts about testosterone? Do you prescribe testosterone?
Yeah, definitely. And kind of my hierarchy is I start with detoxing the body, making sure that the hormones we're using are going to be used safely.
Mm-hmm.
And usually my foundation is getting mighty maca. Sorry,
That's okay.
it's keto green and mighty maca. This is live, you guys, right? Someone came to my door,
Oh,
but
that
Candy
happens
girl.
time to us. We have talked to, so I know.
Yeah. So in my hierarchy is working with DHEA, progesterone and pregnenolone, testosterone and estrogen, kind of in that order sometimes.
Mhm.
Sometimes, estrogen before testosterone, but it really, really depends because, our mother hormones are progesterone and pregnenolone. And from there we'll make cortisol or DHEA. And from DHEA, will make testosterone, which converts to estrogen. So we want to look at these pathways and then how estrogen's detoxifying. So it's part of that perfect balance, but we never just want to, like, I have been doing this now, working with compounding formularies and sexual health specifically where testosterone had its kind of first leg in the door since 1999. So I've
Mhm.
seen the swings over time in our medical community and understanding. And so the biggest thing is when we see someone with low hormone levels, we think, okay, well, what's causing
Mhm.
it? What's going on? I mean, is it natural aging or is it something else? And let's address the something else as we're working to support the body's natural productions of
Yes.
hormones. And so I think that's really important. And testosterone is not, it's a hormone for women as much as it is a hormone for men. And so the things that affect it from being in the healthy range are things like blue light
Mhm.
exposure, right? Wi-Fi and blue light exposure, stress is a huge depletion. Endocrine disruptors like birth control pills and synthetic hormones can affect us too. And so we want to look at what could be causing it: pesticides, herbicides, toxins, mold toxicity. We've seen clinical research supporting that interruption of testosterone, but really specifically, it's this blue light exposure. In Japan, they looked at young men with low testosterone and their screen time. And so they confirmed the increased screen time correlated with lower testosterone levels.
Yeah.
So to think about that. So I got to put my blue light blocker on now as we're talking. So
All these makeups and skin products. So it's just
absolutely.
have to some extent even receipts
Well,
that.
and even the hormones, like for example, estrogel. If we look at the ingredients in estrogel, there are hormone disruptors in there.
Mhm.
And so we have to think, okay, do we have a cleaner, better, more natural option? And always
That's
yes. The answer is
why
yes.
a lot of women opt for compounding hormones to avoid those preservatives and hopefully have a better type of hormone on their
Yeah.
skin.
And then the when it comes to hormonal, and I like to say replenishment therapy versus replacement. Like when we replace, it's like with birth control pills, we're stopping your body from producing what it's designed to produce. So we've created an interruption, a hormone disruption. And so with hormonal therapies, we want to optimize our body's natural production and replenish where we need to for as long as we need to. And so that's really important to consider. And also the way we're taking hormones. Is it oral? Is it transdermal? Is it injection? Is it pellet? Is it vaginal, topical? There are many different ways. And this is where each woman has a unique need, and it can change over time and how we use it too.
Exactly. That's so
So,
important. And sleep. Another very common problem with women, especially around perimenopause. Suddenly they hit 40 and they start waking up around 2, 3 a.m. Myself, one of them. So, what is the best way to deal with this insomnia, sleep
yeah.
problems?
So this is where, first of all, look at what could be disrupting your sleep. So a good night's sleep starts with your morning ritual, right? Your morning habit. So looking at what's interrupting sleep. Is it the glass of wine in the evening? Is it the blue light exposure? Is it your partner snoring really loudly next to you? It could be all of those things.
So it's
And it
just
could be
avoid and remove those things.
right. Right. To the best of our ability,
Yeah.
right? Earplugs, eye mask to make it really dark. I don't know. But, so it's certain things to really help with that. And the other thing is that that 3 to 4 a.m. surge is often a result of cortisol. So really resetting the circadian rhythm, catching sunrises to sunsets makes a huge difference. So I have a whole sleep module within Magic Menopause. And one of our ladies said, she goes, I just changed one thing, and that was in the morning, I'd go outside
Mhm.
and catch the sunrise for 10 to 15 minutes. And she goes, I am sleeping so much better. And she wore a Whoop band, which is like the Aura Ring, and it measures her sleep quality. And she said her sleep quality improved 30%. 30% just by doing that for 10 days in a row. And so, those are disciplines and practices completely free that we can incorporate that into our life can make a big difference. Anyway, it's definitely worth a try.
Mhm.
And the other thing, oral progesterone at night. Oral progesterone converts to the allopregnanolone derivatives and helps support GABA production. And that can help us get deeper, more restorative sleep as long as we're not pushing that cortisol gas pedal. So clients who are taking progesterone, they feel more wired. It's because they're shifting to cortisol. So we have to do adrenal management in those clients too. Yeah.
So just to recap about the sleep, simply by going out 15 minutes every morning and have that sunlight, natural
Yep.
light in your eyes. that is very important for your circadian rhythm, and night to avoid screen, blue light, and just try to calm down. Stress reduction, that definitely helps with your sleep too. It's so important.
Yeah, and
Very important.
you can use essential oils and create an evening ritual too that calms you down as well. But also that a recent study that I reviewed looked at Wi-Fi, and that Wi-Fi at night can increase cortisol spikes. So if you can turn off your Wi-Fi router, if you can at least decrease your exposure to that and give that a try for a while, that may help too. Again, there are many things to try. Also keeping the room pitch black
Yes.
and cold, like 65 degrees is what the science
Mhm.
says. That can also increase restorative sleep.
Yes, absolutely. You mentioned about pregnenolone. So how do you prescribe that? Is that over the counter? People can get it over the counter, or is it prescribed?
I combined it in my balance cream. So there's 20 milligrams of progesterone and 10 milligrams of pregnenolone. And yeah, I use the face, neck, and décolletage because the tripeptide I put in here decreases wrinkles and age spots. So it's a nice, if you're going to if you're going to put a cream on your body, let it give you some good regenerative benefits. So there's that piece. And I will sometimes use a pregnenolone drops or additional, I like the pregnenolone drops in oil because you can also, with these formulas, you can increase and decrease as you need it. I've used pregnenolone oral capsules, which I like in a phospholipid base too, to help with the absorption. But mostly we want to increase pregnenolone by addressing our adrenal function,
Mm-hmm.
supporting, again, supporting our body's natural circadian rhythms, and supporting our body's ability to make it as much as possible because we're designed to have these hormones for our entire lives.
Yes. Someone's saying, I love the way of talking about hormones replenish. That
Me too.
we all love that. And is maca safe for a teenage boy with acne?
Absolutely, absolutely. It's one of the things my daughters used too. Again, I've had four teenage daughters, 16's at home still. And so it's very, very safe. We have, yeah, a good variety of clients on it, really created it as a very safe adjunct. So a lot of athletes, I have an Olympic pole vaulter. I mean, just it's a really good adaptogenic blend. So.
Great. So once again about your tonight's masterclass, how we can get into that masterclass. So
So
we
yeah, just go to dranna.com,
Mhm.
dranna.com, and you'll be able to sign up right there. And I want to see all of you on. So
And is this a Q&A?
there's a live Q&A with it. So we have, I'll be going deep into certain topics like some of the hormonal myths that keep us sick and bust those, right? And also what we can do to empower physiology so we can lose toxic fat. We can get our brain and our personalities, right? Like our charming personalities back. We can feel at home in our body. So we'll talk about some of those key things as well as some of the hormone disruptors that we should all avoid and key lab test. Yeah.
Amazing. Again, you mentioned about the myth and hormones. Of course, not everyone wants to take hormones as long as that's an informed decision and knowing about benefits of
Yeah.
hormones. And if you not want hormones or hormone replacement, it's not for everyone. But there's so many benefits that there's a myth about. Still, in this day and age, we keep hearing women and even doctors worried about breast cancer that we keep hearing. And that's why we're here to talk about these myths and give you an evidence-based information, I think. What are your thoughts about?
Absolutely, 100%. Yeah. Yeah. Again, we've yet to prove that estrogen, especially transdermally, increases breast cancer. We're yet to prove
Yes,
that. So, I think there's so much fear when it comes to women's hormones, and the anti-estrogen talk is very misogynistic, in my opinion, and not grounded in science. So we really want to pay attention to what's going on. What causes breast cancer? Insulin resistance, hormone disruptors, toxicity, inflammation,
Mm-hmm.
right? All of, I mean, those are, an acidic urine pH is,
Yes. So we have
associated. So
hyper.
there's,
Yeah,
mhm, yeah,
definitely.
yeah, exactly.
So Anna, it's just amazing to having you here. I see that you have some
I think so. Okay.
little puppy is a little bit upset, barking.
He's excited. Yeah.
It was great having you once again. Pleasure and honor.
Thank
And
you.
I will join you tonight with your masterclass for sure. And I'm sure everyone loves to see you again and hear you. It's beautiful and amazing, so much informative and so much great talks about all these hormones and holistic approach. I love it.
Thank you. Thank you. And I love everything you're doing. Keep doing it. Keep sharing. You guys, if you're not following me, follow me above at the Girlfriend Doctor, and definitely follow our good doctor. And
And
yeah, okay,
hopefully I
I love
see you.
talking with you. I'll see you tonight, my friend.
Hopefully. You take care. Have a lovely weekend. Take care.
Thank you, you
Bye-bye.
too.
Bye, everyone.
Bye, everyone.